Have you ever wondered why your body hurts? And I'm talking sciatica, neck pain, headaches, lower back pain, achy knees, you name it. Why does your body actually ache? And more importantly, how do you go about fixing that? How can you get your body to the point where it moves freely? And you're not only feeling better every day, but you're also set up to be able to have the level of fitness that lets you do whatever you want as you age. That's really our main point of conversation today and our main topic with our guest, Travis Stewart, who is a doctor of chiropractic and also the co owner of MÜV Chiropractic in Boulder, Colorado. Now, we had the pleasure of meeting Travis in person at an event we were at in Las Vegas recently. And after talking for not even 5 minutes, we found alignment with what we believe around the importance of health and how it impacts your personal performance, your personal leadership, your mindset, and also your professional performance, your ability to show up fully for the work that you do, for the mission that you're on. And so we thought we have to have a podcast together. We have to talk about this. And so we're going to be pulling out the best of his knowledge, but also his story is really inspiring as well. So we want to pull all that together. And if you are a busy, ambitious professional who wants to move freely, who wants to have health and fitness and longevity that lasts, this is absolutely the podcast episode for you, especially if you're dealing with some of those pain issues I mentioned at the beginning. That said, Travis, thank you for joining us. We are so excited for this and welcome to Conquer the Day.
Thank you for having me, guys. I appreciate you bringing me on.
Amen. Well,
Absolutely.
one of the things that I'm curious about after we did more research about you is understanding how you got to this point where you're actually uh, changing people's lives and helping them really become pain free. So I'm curious, and we're curious, how did an injury and an accident change the course of your life and set you on this path?
It's a great question. Well, I started in the military. Sorry, my toddler's knocking on the door.
It's okay.
Um, I started in the military, so I went to the Air Force out of high school, and I was a firefighter actually, which is a just very physically demanding occupation. And I was on a snowboard, and I hadn't spent much time on a snowboard. I'm from Texas, so I hadn't spent much time around snow. And I went toe side to stop and caught an edge and did a backflip and landed on my left clavicle. And I also landed with my head in right lateral flexion, which is commonly known as a traction injury. And so I broke my left collarbone and pretty much had to ride down. I had a concussion as well. Rode down the mountain on my butt on the snowboard. And I actually hid the injury. So I didn't go to the
Mm.
hospital and get treated for the injury that I had because I wasn't supposed to be there. Long story short, in the military and particularly the fire department, you work 2 days on, 3 days off, 2 days on, 3 days off, and then you work 2 days on and you have 4 days off or 5 days off, which is called a Kelly day. So for us, kind of safety regulations stated that we were on call in between our Kelly days. So because I wasn't on a Kelly day, I wasn't supposed to be that far away from the base. And so I hid my injury because I wasn't supposed to be snowboarding.
Mm.
So I went back to training, and you have to wear a pack, and obviously the training is again very physically demanding,
Yeah.
and so I actually started to get something called thoracic outlet syndrome, which is where my brachial plexus had a lot of inflammation around it, and it started to cause my left hand to contract, and I started to atrophy in all the tissue of my left arm.
Wow.
So my left arm started to shrink. I lost a lot of mobility in my left arm, and obviously I couldn't do my job to the ability that I was supposed to. So unfortunately, I finally had to reveal that I was injured, and I got pulled off the truck. And in that time, I was also seeking answers. So I had been to several different medical professionals inside of what I called the medical ringer inside the military, which they kind of sent me to everybody. And nobody could figure out why I was experiencing the symptoms that I was. And so I got really interested and invested into rehabilitation as well as fitness. And I started to rehabilitate myself.
Mm.
And so I was finding all different types of unconventional kettlebell movements and different band work and things like that, just to try to regain the muscle and the strength that I had in my left side. but also just to get back to a level of daily function that I was at previously. And so it really affected my quality of life and really my mental health. And so I had like a depressive spiral as well, and it was really challenging. And I was back home. This was 2 years of a really long journey of getting back to about 65%. And I was back home, and my dad was like, you should really go see Dr. Langus. He was a chiropractor and one of my old baseball coaches and a good friend of mine growing up. And I was like, if a real doctor can't help me, what could a chiropractor possibly do? He said, let's give it a shot. So I walked in and explained to him briefly what was going on and all the challenges that I'd been facing. And he was like, "That sounds like it's your first rib, brachial plexus. Let's get you face down, get you adjusted, and see how that does." So I went face down. He had me turn my head to the right, and he put his index finger right in here on that thoracic outlet and kind of traction my skull, and then gave this quick impulse. And it was a huge cavitation, a crack, as most people know it, because they're seeing videos on TikTok now. And in that moment, I had circulation and nerve flow that flowed into my arm and hand that I hadn't felt in years.
Wow.
And I hopped off the table and I literally had tears in my eyes because I was just so invested in finding answers that no one could give me. And this chiropractor, this quack, right, just gave me more relief in one adjustment than anyone else had ever provided me.
Mm.
And so I hopped off the table and I looked at him and I was like, "What did you just do?" And he was like, I told you it was your first rib." He was like, "Come back, a couple times a week for the next 6 weeks and we'll get it figured out." And it
Mm.
was his certainty and his conviction and his confidence, as well as his application
Mhm.
and his ability to make me feel a before and after experience. But what he gave me was hope. And he gave me hope that I would have a better future, but also confidence that my body could heal itself from the inside out with the right inputs. And so
Mm.
I went back to him just as he requested, and now I have full function. Honestly, I forget which side it was most of the time, just simply because I have no lingering symptoms whatsoever. And it was in that moment I decided I wanted to be a chiropractor and I wanted to be in preventative healthcare as
Mm.
opposed to reactive healthcare, which is what I was as a firefighter.
Mm.
Mm. That is amazing. What a blessing to find that
Yeah.
person in the moment that you needed it.
What did it actually
Yeah.
feel like when you had that relief, though? Like, did it feel like you just had your range of motion back? Did it feel like the pain was gone? What was the actual experience like when you first started to be able to heal? Because obviously now you're healed. What
hmm
were maybe the first phases of that healing journey, and how did that feel?
Yeah, I would say like the immediate sensation that I had was kind of like if you wake up and your arm's asleep because you've been sleeping on it funny, and then you're able to sit back up and get proper blood flow into the arm, and it's like the arm is alive again.
Wow.
Mm.
That's what I felt from the adjustment was that like I actually felt life in the left side of my shoulder and arm, and then after that I was able to actually feel like activation. And I think that's what I had been missing because it was a neurological issue. So I
Mm.
just couldn't get enough nerve flow to my musculature.
Mm.
So I was actually able to feel, just like a pump, I would say would be like a
Mm.
good way of explaining it. Like when you
Makes
have a
sense.
great pump or if you're using like BFR cuffs or something like that,
Hmm.
and like you feel the amount of blood flow and like contraction that you can get from very simple movements. It
Hmm.
was like the simplest things, like picking up a water bottle or something like that. It didn't feel like a phantom limb. It felt like I actually had control
Mm.
over my appendage. And so at that point, I was able to get back in the gym and make a lot of progress really quickly.
Mm.
And in that, I also realized that um, that function is more important than form. Because for a few years prior to, I was like very aesthetically driven
Mhm.
in the fire department. And now that I had lost function, I realized how important it was to have that. And so from that point forward, I was always the weird guy doing weird things in the gym because I wanted to maintain my ability to function well into my later years. So it was
Amen.
great.
Yeah, and since you brought up function versus form, I think a lot of people will hear form and think that you mean like the actual form of the exercise, like your form within the exercise. That's not what you mean, right?
Mm-mm.
It's how your body looks versus how it functions,
Exactly.
right? So how did it go from personal healing, which was immediate, but then over weeks, as you mentioned, maybe months, not sure,
hmm
but how'd you go from that to actually pursuing chiropractic care? Because that's, I mean, you have you're a doctor, so it was a long
Mhm.
education process. And then obviously it's transformed into, as we know it, entrepreneurship. So it was a business event that we met you at. But how
That's
did
right.
it go from that one healing experience to pursuing the education and then all the way to entrepreneurship? What was that journey like?
Yeah, it's a good question. I think most of us in this life are like constantly and perpetually searching for purpose. And I believe that once you experience hardships and you go through a lot of challenges and tribulations yourself, and then you come out the other side of the dark tunnel and you've found answers and you've also found a way to improve your situation, you want to go back and like spread the word to anybody who needs it? And so I think it was in that moment that I was just like purpose filled and passion driven because I not only had experienced this passive modality that facilitated healing inside my own body, but I was also able to then go and curate like a rehabilitation program that again was very unconventional, not based on physical therapy practices of modern day. That's typically like a dusty sheet of exercises from 1986. I was able to really look into different functional movement modalities and take from some of the greatest movement minds and curate a program that was better suited for me to actually regain the function, not just of the arm, but how the arm integrates to the trunk and how I can actually use it to do compound dynamic movements, which is how we actually move through our day to day.
Mm.
And so once I started to put all those pieces together, I just realized that I had a formula for long-term well-being. And
Mm.
it was just something that really inspired me, that I wanted to be able to share that with people, especially in today's society where we don't move like our ancestors. And our bodies developed over thousands of years of moving like our ancestors. And so all of a sudden, after the Industrial Revolution, everything changed. And so we started to use more technology and less of our body. And because of that, we've grown rigid and
Mhm.
stiff and less range of motion and less physically able.
Mhm.
So go
Well,
ahead.
I was curious. Yeah. So one of the things you talked about is the functional movement pattern. Um, what are some of the actual root problems that people have that cause pain, though? So I think that most people come into the conversation talking about neck pain, back pain. They understand the basics of, yeah, I sit, I don't walk, like I'm not getting any kind of movement in. But what are some of the underlying patterns that you might see that start to create these cycles of pain, whether that's lower back, neck, their dysregulation of
Mhm.
how we're moving, the imbalances overall? What are some of the root problems so people can start to track from there to the rest of the conversation?
Especially if it's not an acute
Yeah.
traumatic injury, like an accident or something.
Most of the time, it's not.
Yeah.
90% of the people that I see, it's from chronic, which like insidious onset is what it's called in medicine, which means it creeps up over time.
Yeah.
Mm.
And typically they come in and they're like, I've never had a problem with my low back, but it started, X amount of years ago, and it's just slowly gotten worse until
Worse.
finally I'm in your office today. And it's a pretty simple answer, and it kind of goes back to the same theme that I just mentioned, which is people don't move enough.
Yeah.
They don't move well and they don't move often. And I think a lot of times they don't move well because they don't move often.
Yeah.
Mhm.
Typically, like the more that we move, the better that we move. Our brain is extremely intelligent and we have a cerebellum. Like our brain is just so complex and its ability to receive inputs from our external environment as well as our internal environment, and then process that information, and then be able to spit out accurate motoric outputs to tell the muscles to do what they need to do so that it can not only expand the body, against gravity, which is important, and we can talk about that. Gravity is, a huge component to why people experience what they do, but it also allows that neuromotor control that is very neurologically involved. And what I mean by that is your body has to have motion in order to provide the brain with information on where it is in space
Yeah.
so that it can take that information and then send information out to the muscle so that it can move you accurately in
Mhm.
conjunction with that.
Yes.
And we have all of these little bitty GPS organs that are in all of our muscle tissue. And those GPS organs, Golgi tendon organs, muscle spindles, and things like that, like their primary job is really to just tell the brain where you are in space and tell your brain where that joint is in space.
Mhm.
And based on that information that's being received by the brain, it then again processes that information, and then it sends the nervous system input out to all of the muscles and tells them how to then move based on the information that it received. And so if you're not moving, you're not sending those signals to the brain, which means that it's not getting the amount of information that it needs to maintain first elastic properties of the soft tissue, but as well control. And
Mm-hmm.
control is everything.
Bringing it down to someone else's level who might not even be working out. It's like, think of yourself when you were maybe 15 years old or 16 years old and you played basketball all the time. It's very easy for you to jump and land and jump and land. And that's mostly because not just that the body was elastic, right? More elastic than it is when you're 40, but because your body was trained for it. And so if
That's
you
right.
jumped when you were 16 and 18, and then you spend 20 years not jumping ever again,
And then you jump.
and then you jump, it's not only that the tendons and ligaments are weak from underuse, it's that your brain and body do not have the connection for how to land, how to balance, how to move safely. And that's
Hmm.
where what I'm hearing is that's where injuries happen, is because our brain is no longer connected to our body in space and time on how to move, how to balance, how to catch ourselves. And then we are underworked. Therefore, we don't have strength, we don't have muscle, we might not have bone density, and that's where injuries can become long term.
More
More
prevalent.
Totally.
is that a
You're
layman's?
right on. You're right on. Yeah, it's a software program that hasn't been used.
Yes,
And we're so energetically efficient that the things that we don't use, we what?
you lose.
Lose.
Yeah.
We lose. Yeah.
Mm-hmm.
I mean, it's an old cliche, but I'm constantly communicating old cliches in my practice, and they're old cliches because they're true. You know, if you don't use it, you lose it. If you don't use that software program, you lose that software program.
Mm-hmm.
So a lot of people come in and they think that their body is incapable of performing specific activities. That's not true. You've just conditioned your body to stand in a stationary, static position that is still rigid and stiff for so many years and then not asked it to do these things that not only do you not have, like you said, the tissue capacity or the tissue ability, but you also don't have that software program. So if you all of a sudden decide to go out and play pickleball for 4 hours and you haven't done any form of movement or mobility or dynamic responsiveness or asked your body to react to something in a coordinated way, then there's a really high likelihood that you're going to have an acute injury. And
Mm-hmm.
also, if you don't ask your body to move on a daily basis every single day, several minutes an hour, not just once a day. A lot of people, there's a misconception that people think they can out exercise a sedentary diet, and you can't spend 2 hours on a bike or 2 hours in a climbing gym and regain or maintain the amount of mobility that your body needs to not break down if you're sitting in front of a computer for the other 8 to 9 hours a day.
Yeah.
So yeah, there's a lot that goes into it.
And what are the downsides of the sitting for 8 hours a day? What are some of the things that happen and wreak havoc on someone's body
Mhm.
just from that? Nothing else necessarily, no acute injuries. What do you see most often?
So that would be twofold. I'll break it down into like soft tissue and hard tissue. So from a soft tissue standpoint, which is what most people are concerned with, and I would even say that like most people in the fitness realm, just because they don't get to see what's on the inside, and so because when you don't see what's on the inside, what's always front of mind is going to be the soft tissue because it's what you can see and it's what you can feel and it's what you can control. From a soft tissue standpoint, things start to stiffen and start to tighten. You lose a lot of your elastic properties of the musculature. You also lose the hydration in the fascial system. And so you you also train your body to stay in a stationary position. So again, our brain is very energetically efficient. We become what we continually do, which means when you are in a seated position, you're actually training your body to get better at being in a seated position, which means that you're training your body to get worse at being in a standing position or any dynamic position. So then, whenever you sit for that amount of time, the brain is actually having to contract tissue on the front side of the body. It's having to lengthen tissue on the back side of the body. Your hip flexors shorten. Your knees move into flexion. Your ankles are in slight plantar flexion. And so because of that, now when you stand up, you've pitched yourself into typically like an anterior pelvic tilt. You've lost dorsiflexion of the ankles. You've lost the ability to get down into a fully flexed squat position. And so it's not necessarily that you yourself are tight or rigid or I have bad knees. It's just that you've conditioned your body to do other things. And
Mm-hmm.
so there's this balancing act that you have to maintain if you want to maintain longevity in your body. And then the second part to that would be the hard tissue, and that's your skeletal structure. And that's something that we don't learn enough about, but we also don't pay enough attention to it because you can't see it. In order for you to see what I see, then you would have to be seeing the amount of x-rays that I see on a daily and weekly basis.
Mhm.
And so I would say the primary thing that we see from people that sit too much is spine degeneration.
Mm.
And I think that that is going to become one of the strongest epidemics that we're challenged with as a culture, just simply because we don't move like our ancestors did.
Yeah.
And
Now,
and
what
we,
does when people have spine degeneration, how does that actually translate into their daily life? Like, how does that feel, or what do their doctors tell them?
Mhm.
What is the actual output or not benefit consequence of spine degeneration that people experience?
Yeah, I mean it's a loss of general mobility. So, typically somebody who can't forward fold or bend forward to touch their toes like they used to, they're immediately going to say it's because my hamstrings are tight. But what's actually happened is that their spine has gone from having a lot of volume and hydration in their intervertebral discs, which are the shock absorbers that are in between the spinal vertebra. And typically, when you don't move, what happens is those begin to dehydrate, which means they begin to degenerate. And so, as they dehydrate and as they degenerate, the bones get closer and closer
Mm,
together. What also happens is that because you are asking your body to stay in a stationary static position so often, you actually start to build scar tissue or adhesive tissue around the spine. And so now you have adhesions in the spinal column. You've also lost your intervertebral disc. And so, because of that, you're putting stress on different parts of the bones, the hard tissue. When that happens, the body actually lays down bone along the line of stress. So, because you have stress, friction, and compression on the wrong areas of the spine, it actually starts to grow stuff off of it. And so, that's what arthritis is. And so,
mm,
people will come in and they'll blame it on tight hamstrings. But when we take, a spinal x-ray, we see that they're in stage 3 spinal degeneration. And this is your engine. This is where, first off, you have your spinal cord that traverses down through the spinal canal that comes out into spinal nerves, and all those nerves go out. And that's what communicates to the body all of the signaling and information that's coming from the brain. But secondarily, it's what allows you to move through all of these dynamic ranges of motion. And so it's like you can think about any car that you'd like to. I'll just use a Corvette for example. You can put great rims and tires on a Corvette, which means that you can have the best shoulder mobility and the best, knee and ankle mobility that you want. But if you don't have the engine to actually be able to propel that vehicle forward, then it doesn't really matter, what kind of rims and tires you have on the vehicle. And so what we see is that people put a lot of emphasis on the things that they can see, but they neglect the engine, which allows them to actually have dynamic range of motion through the frontal plane, our coronal plane, our transverse plane, sagittal plane, all of those things. And if we neglect the spine and we do it for 15 to 20 years, there comes a time where it becomes irreversible, unfortunately. And so now we're seeing a huge uptick in spinal surgeries and spinal fusions
Yeah.
that, and I'll throw this in there, that a successful surgery is deemed by a 33% reduction in pain, and there's only a 33% success rate. So 33% of spinal surgeries are actually leading to a 33% reduction in pain, and that's the solution that we're throwing at people instead
Mm-hmm.
of just educating them.
Yeah.
Yeah.
Well, what I was gonna, do
If
you want to
you
jump?
if
Sorry,
you
Elise.
weren't to neglect your spine,
Mhm.
what would you be doing?
Great question. I mean, you could probably see over here, I'm constantly moving. So I would move first off, first thing in the morning. And, for anybody out there who doesn't understand really complex, like dynamic movement patterns, you just ask your body to do what it does. And that's how I put it, is if your body can bend forward, bend forward. Your body can bend backwards, bend backwards. Your body can bend to the side, bend to the side. Your body can bend to the side and rotate, bend to the side and rotate. And do that with every region of the body. And so if you just look at the anatomy and the biomechanics, we're so intricately designed to be able to move through all of these planes and dynamic ranges of motion. And all you need to do to maintain those ranges of motion is maintain those ranges of motion.
Mm.
So it's not as complex as sometimes people may think that it is. We like to label things and, say I use that movement methodology
Yeah.
or I use that mobility protocol. But
Yeah.
when it comes down to it, it's really just moving your body through the planes of motion that we developed over thousands of years of moving our body through those planes of motion.
Yeah.
Mm-hmm.
So that
Yeah,
would first recommendation.
beautiful. And for somebody who hears that, it's to things that you have heard of, but maybe don't value as much as you need to. Might be even like a cat cow, right?
Totally.
Or an external like if you're down on all fours and you open up your elbow or your hand to the side and you twist, right? That is moving in a different plane of motion. If you do a barrel roll with it's kind of like a cat cow, but you can imagine that your spine kind of goes down, up and around like a barrel shape. Even just
Absolutely.
doing a few of those is exactly what you're saying, but with labels, of
Well, the
course.
key is being able to also meet your body where it's at too. And I think that people think like, well, it's not the right way.
You need to go to an hour-long yoga class
It's not
or
the right way. And then you have also the mindset of like, well, I think that this all gets mixed up in weight loss,
totally.
right? It's like, well, why would I go and move if I'm not going to go and burn a lot of calories or I'm not going to go and be able to build muscle? And what we're really describing, at least is what I'm picking up from this, is it's resetting your foundation for movement. It's resetting that foundation. If you've been sitting all day long, it's
Right.
how can you be more in tune with what your body actually needs? And that's going to be the starting point for you to advance to more of a pain-free modality. Is
And
that
if
kind of the grasp, Travis, or what would you say there?
Yeah, I mean, absolutely. I think that you have to obtain a foundational level of mobility to be able to go and condition your body or ask your body to move at a level of intensity that burns adequate calories so that you can be on the right side of the formula,
Yeah.
which is burning more calories than you're taking in. And a lot of people unfortunately go through that slippery slope or that downhill slide because their body um, either it goes one or two ways. Either their body can't move the way that they used to, so it hurts when they move, so they don't move, so they gain weight, or they go through a really challenging time where they just neglect movement and exercise and they're eating the wrong foods, which a lot of people, most people are. They're eating the wrong food, so they start to gain weight, and now their body doesn't move like it used to, so it's discouraging to them to actually try to move. And so it's really unfortunate. And so you're right. You want to just start extremely simple movements. Lindsay, you're not wrong. Like get on the floor, do a cat cow, go through kind of like a T rotation or something like that. Rotate the spine, flex the spine, extend the spine, flex the hip, extend the hip, rotate the hip. Do the same thing for your shoulders. It doesn't have to look a certain way. But if you do that every single day, then you start to gain momentum. And those are very metabolically intense activities anyway. So like especially if you're doing like what I'm recommending, which is moving throughout your day, then you're not trying to like consolidate all of your movement or
mm-hmm.
calorie burn into an
An
hour
hour.
of time, you know? And I think that's where a lot of people have that mental justification. Well, I can just sit here all day for 8 hours because I know I'm going to go work out at the gym later. And
Yeah,
I don't think that
done
that's
that.
the formula either, you
Yeah.
know?
Totally. I've done it. It causes more pain.
So we're supposed to be talking about cracking our necks and shoulders and knees, and we've been spending the last 30 minutes talking about how to move. I just want to know, how do I get my shoulder to feel better, right? So I say that very facetiously, because
Yep.
where does chiropractic work fit into this, right? So we start to move our body well,
Hmm.
and then there's still some adjustments or some changes. What is chiropractic work doing in unison with movement, and what is the advantageous route that it helps with our movement patterns? Why would we lean into that direction?
It's a good question. And there's several different ways that I can answer that depending upon where the person is. So, a lot of times right now in our office, I would say 60% plus are people that are at a dead end road. And they've had a similar route through like the medical ringer or going to different professionals looking for answers on why their body feels like it does and why their body doesn't move like it used to. And they're at the point where they're about to give up. And I understand why, because chiropractic hasn't had a great reputation in the United States for about the last 100 years. And I could tell you that story too if you want to hear it. It's really interesting on why that actually is. But a lot of times people come to us as a last resort. And when they come into our office, we are able to take them through a really comprehensive exam. And that exam is orthopedic. So we go through a full orthopedic exam and we actually test like where is the problem? Not where's the symptom, not what are you feeling, not like where are you feeling pain, but where's the actual problem and the source of the pain coming from? Because again, pain is extremely complex phenomena, and a lot of times people come in thinking that the pain is the source of the problem, and a lot of times it's upstream or up there like biomechanical chain. So we find exactly where the problem is. We do digital X-rays to see, if there is any of those arthritic processes that are limiting them in their ability to move, and then we put together a little corrective program for them to essentially provide for them what was provided for me, which is hope, clarity, and a plan of action. And that's what people want. And so we first have to stop the boulder from rolling down the hill. And typically that's where people are when they come in. They're going down the wrong side really quickly. So we stop the boulder from rolling downhill. We say this is why your body's breaking down the way that it is and as fast as it is, which is leading to the dysfunctional outcomes that are making up your current experience in life. And we start to give them adjustments, but we also provide non-surgical spinal decompression, which actually can stretch the spine apart and recreate and rehydrate a lot of the space in between the discs. And then we give them a corrective exercise program on top of that. And so, we like to work off of the mobilize, stabilize, strengthen protocol, and it's something that we built out on our own, that we've studied under several different thought leaders in the movement space, and we just cherry picked. We think that a lot of these movement icons or people in the fitness space can be very radical and somewhat dogmatic, depending upon what they believe. And so we just like to stay open-minded. And so we would just go and we would just grab from several different modalities and put together what we thought was the most useful, and we break it down into region. So if somebody has like a low back and sciatica program or a problem, we put them on a low back and sciatica corrective movement program.
Yeah.
And it's very, very slow. And we just get them moving in the right direction until eventually they can make their way to somebody like you, or, work with somebody that's going to be able to take the torch and now take this person that is finally able to move and feels willing to move and is inspired and motivated again and feels like they got their life back. And then they can go, move into something a little bit more intense. And they can
Mm-hmm.
start to make it more of a fitness journey as a part of like, how do I get out of pain and just live a normal life again?
Mm-hmm.
Mm-hmm.
Well, I just want to tie this down to the question too, because what I am hearing too for the person who's coming into to chiropractic work, because sometimes people will say, "Well, I just need to get an adjustment." I've seen this happen for a lot of people. They'll go and they'll get an adjustment, and then they'll wait till they get and pain again, and they'll go back for the adjustment. And it's often, from at least my perspective, a sign that they're not doing the corrective exercises, and the problem keeps exacerbating itself.
Hmm.
But really, what you're saying, just for the other person, it sounds like the tool is used to reconnect first the neurological and muscular connection in the body. Is that when you're getting an adjustment, is that essentially what it means, or what is the actual purpose of an adjustment for that
That's
person
exactly
who's,
right.
yeah.
Mm.
Yeah, so you know more about the chiropractic adjustment than most people. Um, it is very neurologically involved. So, like I was just talking about, the spindles and the Golgi tendon organs that line all the muscles in our body, that's constantly feeding the brain with that sensory-based information that allows it to accurately process the information coming from the body to the brain, and then allows it to send out better motoric messages to all of your muscular system. Most of those sensory organs line the muscles of the spine. So if you look at the spine and you're looking at the spine without any of the musculature on it, you can see that there's these things that stick out. That I have one here. There's these things that stick out, you see, to the side and to the back. Okay, looking like spider wire all the way up the entire spinal column here is little bitty muscles that nobody knows the name of. Most people don't know the name of.
Mm.
And those muscles are very neurologically dense. So 50% of those neurological organs that are sending that sensory information to the brain are actually in the upper cervical spine. And the rest of that density, in majority, lines the rest of the spinal column. So most of the sensory information that goes to the brain comes from the spine. And so any time that we start to get stiffening and rigidity and any type of dysfunction segmentally in the spinal joints, it means that those muscles are not firing and sending adequate information to the brain so that it can process it accurately and then send out accurate messaging out to them to actually support, stabilize, and move the spinal segments. So those muscles start to atrophy and they start to turn off. We start to lose that software program. When that happens, all of the rest of the big muscles that people do know the names of start to stiffen. And so it's like a security team comes in. Because it's not receiving the adequate GPS information, it's like shut it all down, bring in the security team, tighten everything up, and don't let it move because I don't know where it is in space and I don't know if it's safe. So when that begins to happen, it actually accentuates and accelerates the degenerative process, which means that your body can't move the way that it was supposed to. So when we give an adjustment, we're actually assessing to see where do we have segmental dysfunction, where are those muscles not working properly, and how can I provide a very scientific and specific force at a specific speed, which has to be 200 milliseconds or faster. Not all chiropractic adjustments are the same. It is a very skill-based profession, and if you find a great chiropractor, they're typically worth their weight in gold because they understand and they treat the adjustment almost like a martial art. It's very fast, it's very precise, and it's very accurate. And so when you go in there and you find that segment and you can actually send that 200 millisecond impulse into the proper vector or direction, then you can actually ramp up the firing of those proprioceptive organs. It floods the processing centers of the brain with information that it's been searching for. Your brain can more accurately process where it is in space and more accurately send out messages to all of your neuromuscular system. That's why when you get off of a chiropractic table, you're like, wow, I have better range of motion. I feel lighter. I feel like I can move better. It has nothing to do with racking a bone back into place and everything to do with like revamping that neuromotor and sensory motor based pathway. And so we're now seeing chiropractic research is finally catching up after 100 years. We haven't had the budget that the medical profession has, and it's because chiropractors they're typically entrepreneurial, so it's mainly private practices, and we're not a part of the big system. And we also are a competitor to the big system because people come to us to look for conservative management-based solutions instead of going for a prescription drug
Or
or
surgery.
instead of
Or
or
surgery.
surgery or a surgical consultation. And so they've been trying to squash and squander us for 100 years. They actually had the American Medical Association actually had a campaign against chiropractors where they actually started to call them quacks in the early 1900s. That's where that name came from. And it was a smear campaign. And they actually started taking chiropractors to jail for practicing medicine without a license when all they were doing were reading x rays and adjusting people's spines. And so, unfortunately, we've had that battle continue, and it still continues today. And so, we have several different chiropractic associations that are constantly having to fight and litigate against regulation from the medical profession. And it's because people come to us and get better long term. As long as you're going to someone highly skilled, there's
Yeah.
just like any profession.
Yeah, and that brings up a really, I mean, two questions really, so I'll take them one at a time. But I grew up with a chiropractor, and he was a very old man, and never really felt any different. Um, it was basically just he'd use one of, bless his heart, but he'd use one of those little
Hmm.
tools. I don't know what they're called,
Yep.
but
Like a
little,
low force tool, an
yeah,
activator.
an
Yeah.
activator, and
Hmm.
crack my back, crack my neck, and then all right, see you in a couple weeks. No real understanding or education around it per se. I'm sure there was some, but I don't recall any. So how do you spot a good and bad chiropractor? Like how do you know the difference, especially if people have had bad experiences where maybe they go get cracked and then they feel way worse? What should they be looking for?
It's a good question. And I have to answer it all the time because, people will be traveling or family or friends, asking me. And honestly, I would start with the website and I would try to see like what message are they conveying because communication is important. What are they saying that they're doing inside of their office? And then I would just look for someone who looks extremely coordinated. Like I like to say that it's a professional sport. Like you have to train speed, you have to train power, you have to train precision, and you have to be really good with your hands. And if you're complacent in chiropractic, just like if you were complacent in any sport, you're going to be very mediocre, which means you're going to get mediocre results.
Mhm.
And a lot of times there is a pop and pray mentality with some of those chiropractors. And it's like, I'm just going to do the same things to every person, and 80% of people are going to feel better, and 20% of people won't. But I would say just assess the way that they move around the table, the way that their hands. I mean, you have to go in and experience it. That's the only unfortunate piece. You have to be willing to go in for that first visit and feel their hands on you and feel like, does this person feel confident and competent? And do I feel like I trust them to provide me with frequent chiropractic adjustments? And then you can also have the before and after effect. Like, I felt like this before I got adjusted, and I felt like this after I got adjusted. It felt like it was a good adjustment. Outside of that, marketing nowadays is really great. People can say what they want to say and they can portray themselves as things that they're not. So reviews, testimonials, and your own
Mm.
personal experience is the only thing that I would listen to.
What questions would you suggest people ask? Because what you're saying is very intuitive, and I would feel confident that like maybe Brian and I could do it. But for
Yes.
somebody who
It's totally turned off from
it's
their body.
yes, for somebody
Yeah.
who's totally turned off from their body, does not have any experience, is just kind of going in for the first time. Yes, they have to experience it, but similar to a doctor, right? There's valuable doctors, of course, but what questions should they be asking to get a sense of their philosophy or their approach, their methods that suggest this is either going to last and be really helpful, or it's kind of a quick fix, pop and pray, as you say. What questions would they ask? What would they actually look for?
What are you looking for? What did you find? And how are you going to correct it?
Mm,
That's probably the three questions that I would ask.
there you
And
go.
I think you can extract a lot from those questions. And also, I think that their willingness to provide you with information is a good sign on how they practice. Do they practice with integrity? Because
Mm.
if they get offended by you asking them those questions, they're probably not the chiropractor for you.
Or
If the,
confused, right?
Yeah. Or if
yeah,
they
if
seem
they
confused by the
welcome those
question.
questions, and they're like, that's a great question, and I'm glad you asked because I want people to hear this and I want you to understand this because you're entrusting your body and your communication superhighway, your nervous system,
Yeah.
with my hands. And you don't really know me. So I completely understand where you're coming from by asking me that question, and here is my very thoughtful answer.
Yeah.
And it's a conversation. It
Yeah.
should always be.
Good.
Well, what's great is anyone can now have this podcast as a reference point because they'll understand why they're getting adjusted, why they're going about the process that they are, and now they have some different reference points for them
Yeah.
to actually ask and discover more.
And very briefly, what's the difference between a chiropractor and physical therapist?
It's a good question. So most physical therapists are not trained in chiropractic adjustments. They're trained in joint manipulation, and that's a slightly different technique. So they're generally looking for like gross manipulation, which means that they're just trying to mobilize all of the segments of the cervical spine or wherever the affected area is. Chiropractors are looking for the one segmental dysfunction that is most apparent, and they're looking to make that correction. So it's specificity, I would say, is the difference between the adjusting styles or mobilization styles of a chiropractor and a physical therapist. Also, I would say that chiropractors typically spend most of their time on the spine. And I would say that physical therapists spend their time on different regions of the body. And so because of that, I would say that we're spine specialists. Like we extensively studied the spine and the biomechanics and the arthrokinematics and all of the big words, but essentially mean like how the spine is structured and how it moves, and the safest ways to apply forces into the spine that can be taken by the body as constructive inputs, not destructive inputs,
Mm.
so that it can facilitate a healing process.
Love it.
Excellent.
So, Travis, I mean, we've had a fantastic conversation. I think this is going to add a lot of value to people's lives. One tie down question is who should consider going to a chiropractor and when? Right.
Mm.
So,
That
who
is a
should, yeah, I know it's a big question, but for someone who's at the end of this, like, okay, I've got some interest. Maybe I need a little bit. So should
Yeah.
I test someone? Should I go to see someone?
Especially if it's not extreme, like if they have like slight sciatica, or if they have like slight neck pain or some symptoms we've talked about, but or they're kind of stiff, but they don't have an injury, right? Screaming issue. That's maybe where the question should lead.
Yeah, I mean, obviously I'm biased because I am a chiropractor, but I think that most people in today's society should go be checked by a chiropractor. I don't know if they need to be adjusted, but I know that they should be checked. And the main reason being, like, we spend so much of our time on these. We spend so much of our time on phones, on computers, in seated static positions, in the front seat of our car, in driving positions. And so, because of that, our spine and our body is starting to take on a shape that is not conducive to long-term joint health and mobility. And movement is medicine, life is motion, and if you want to live a long, healthy life, you need to be able to move effectively through the entirety or at least the majority of it. And I always like to say, when I'm talking to patients, if they get somewhat concerned about the state of their spine and they're like, how did this happen? Typically, my answer is it started 15 years ago. This is not something that started overnight. You may have felt this symptom arise 3 weeks ago, the first time you ever felt low back pain, but looking at your x-rays, this shows this was a 20-year process. So if you would have walked in my office or someone else's office 20 years ago, there's a great chance that we could have kept this from happening. But we
Mm.
don't know that. So we can only see you and serve you from where you are today. Which means that if you have any type of symptom, no matter how small and limiting it may be, I would certainly go look to the source of it and just make sure that there's not something that you can do today to improve your quality of life and the way that you enjoy your life tomorrow and beyond.
Amen. That's
Mhm.
fantastic.
Excellent. I want another hour. So we're going to close with some quick fire questions, though.
Sure.
I'm going to ask two
Mhm.
because
Okay.
one is selfish. What is your favorite either recovery tool or product just to aid with the recovery restoration process?
Mm. I have two that serve different purposes. Can I give both?
You may.
Red light panel, which I have on my wall right here. I use that every morning. I would say that that's how I start my day. And then obviously cold water. So I love cold plunges. I love getting into, I'm in Boulder, Colorado, so I love to go get into the creek and spend about 3 minutes in that. But I think the systemic anti-inflammatory response by the body is incredible, but also what it does for my brain chemistry is also equally as important.
Amen.
Excellent.
What's one thing you wish everyone did with their body?
Mm. I mean, I would just say like move it every day intentionally, and feel it. Hey, that's a good answer. Feel it every day, I would
Mhm.
say. A lot of people don't feel their bodies. They're just not attuned to what's happening inside of it. And I think that a lot of times that's where we can get into like chronic disease states that are detected too late. That there were signals, there were
True.
whispers that were happening for many years, and they finally turned into a yell, and you didn't listen until it was screaming. And so, then typically you're scrambling and you're putting all of your attention, focus, and energy into how can I become healthy again, instead of just doing that in small incremental doses over, your daily life.
Amen.
It's a
It's a lot easier
really
to
good point.
maintain health than regain it.
Absolutely.
Yes, 100%. And where can people find more about you or your practice or your guidance?
So I'm at Travis underscore the chiropractor on Instagram. My practice is MÜV, MUV underscore Chiro Boulder. And that's pretty much it
Podcast.
that's applicable to this. I have a podcast, but it's business related. But it's called Making Moves. And yeah, it's MAKINGMUVS. And mainly it's business for chiropractors because you're right. Chiropractic is very entrepreneurial. I was hoping we got to talk a little bit about that, just being a busy professional and how to prioritize health and fitness and how that can help you elevate yourself as a professional. But it looks like we're out of time.
It's
I know,
okay.
I know. I was gonna say we
Well,
that's why I say we need another hour,
You can
but
ask more questions. I'm available, but
no, I think the big thing here is I think that this is going to serve as a really solid foundation for people who don't understand why they need this. I think that people can, at least on our show, people understand, oh, yeah, it's the benefit of being a healthy person and being a leader, and fitness is a part of your self leadership. Like those things are easy because it's connected and most people can conceptualize it if they're in the personal development or let's say coaching space or they're at least executives or managers. But I think the knowledge gap on what we talked about is just so far
it's
out of
big.
people's perspective that this was a really well-rounded episode for people who are looking for more knowledge and understanding. Because once people have the understanding, they connect the dots as to why they should do it. But
yeah,
it's like someone who's like, oh, I understand I should eat healthy, but I'm not going to lose weight anyways. It's like, well, that's not the point. Here's why you want to do it. Okay, now I understand what you mean by eating healthy as a lifestyle or philosophy, and then people tend to follow through. So I think that sometimes as coaches we give people too much credit
hmm
for what they know because we know it so well. And this is a great example of, hey, no, I think this is a really well-rounded episode for people to gain the knowledge of their body, gain the knowledge of their movement,
Yeah.
and understand where they can get support to be pain-free. So I loved it.
Yeah, I agree. I think it's a foundational conversation and that's extremely valuable. But I do think that we should have another conversation specifically catered to movement and self-leadership and how that really does flow in and optimize your performance.
it's
That should be
everything.
the
Yeah,
next part two.
Amen.
Part two.
it's
But
everything.
nonetheless, is there anything else that you want to like just share as a final statement or
Final
billboard?
thought, closing
Mhm.
thoughts. Yeah, I guess one of them would be, the position that I'm in as a medical professional and where I get to see people is, I guess to say it simply, like when you're healthy, you have several priorities. And when you're not, you only have one. And so keep that in mind, like when you are quote unquote healthy and you don't feel things in your body and you don't have anything glaring and you don't have something that demands your attention right now, you get caught up in the day-to-day of life and just kind of a lack of presence and gratitude, for what we truly have in our bodies and what our bodies are capable of. And then as soon as that's taken away from you and you have a health challenge, the only thing you care about is being healthy again.
Mhm.
Nothing else matters. And so, whatever you can do today as an investment to make sure that your body continues to perform and pay dividend and allow you to, spend years with your children and years with your grandchildren and hopefully eventually your great grandchildren, prioritize those things today because you can never take it back.
Mm-hmm.
And I would say that's something that I get to see day in and day out is people coming in at 65, 70 years old that are like, I just can't do the things that I want to do. And I wish I would have done something different 25 years ago. And if
Mm-hmm.
I could go back, that's the advice that I would give my younger self. So
Mm-hmm.
I get to hear that all the time, and I can share that with you guys. Take it for
That's
what you will.
Hey, man, it's beautiful.
beautiful. Well received. Awesome. Well, thank you for
Cool.
joining us and looking forward to doing it again. And for all of you guys who are out there, make sure you follow Travis. He's got some great content. If you happen to be a chiropractor, somebody in the chiropractic space, feel free to share his podcast. But we will,
That'd be cool.
I'm sure be back and take this, go move your body today and go out and conquer it.
Cheers.
Thanks, guys.